Hello, everybody. Dear esteemed participants, ladies and gentlemen, we are pleased to welcome you to this pre-conference event organized under the aegis of the ARC-AU platform, that is the African Regional Platform on Gender and Disaster Risk Management, which is taking place under the 8th Africa Regional Platform for Disaster Risk Reduction from 16 to 19 November in Nairobi, Kenya. Under the theme, Towards Disaster Risk Informed Development for a Resilient Africa in a COVID-19 Transformed World. This gender and DRR event is in the context of the 8th Regional Platform, and it is intended to examine the impact of COVID-19 on vulnerable populations living in disaster-prone areas in Africa. My name is Babatunde Iyonda, and I'll be your moderator. I'm with the AU Partnerships and Policy Technical Services team as a Partnerships and Liaison Officer within the ARC. And you're all welcome to this event. In terms of the flow of the meeting, I will hand over the floor to Ms. Marie-Jose Kandanga, who is the Women, Peace and Security Advisor for West and Central Africa UN Women, to deliver a keynote address for the session. Ms. Marie-Jose, you have the floor.
Merci beaucoup de m'accorder la parole. Distingués invités, chers participantes et participants, auguste assemblée, je vais commencer par vous transmettre les salutations de ONU Femmes et c'est un réel plaisir d'être avec vous aujourd'hui pour partager les réflexions sur le genre, la réduction des risques de catastrophes en période de COVID-19. Et d'emblée, je voudrais commencer par dire que le contexte de COVID-19 que nous vivons actuellement nous rappelle la contribution essentielle et souvent invisible des femmes à tous les niveaux, notamment en tant qu'intervenantes en première ligne, en tant que professionnelles de santé, en tant que bénévoles communautaires, en tant que personnes qui sont dans le secteur de la santé aussi, mais également en tant que personnes qui s'occupent des charges familiales. Et vous le savez très bien, les femmes jouent un rôle très disproportionné dans la réponse. Et là, en guise d'exemple, on peut prendre le cas du personnel soignant, où on a jusqu'à 70% des travailleurs du secteur sanitaire et social qui est composé de femmes. Et également, un autre élément important, c'est le rôle au niveau de leur ménage à travers le travail non rémunéré, et notamment en prenant en charge qui sont malades mais qui restent à domicile. Le secrétaire général des Nations Unies a précisé que la pandémie actuelle risque de porter préjudice aux avancées que nous avons eues en matière de genre. Cela a été surtout motivé par le fait qu'il y a beaucoup d'impacts négatifs sur les femmes pendant la période, notamment en rapport avec les violences à leur égard et notamment en rapport avec le confinement et les déficits au niveau économique qui ont été enregistrés par les femmes qui sont souvent dans le secteur informel. Et là, ce qu'on a vu, c'est quoi? On a vu que beaucoup de millions de femmes sont actuellement exposées à des risques et que malheureusement, le constat, les plans de réponse à la crise n'intègrent pas systématiquement les mesures tenant compte du genre. L'ONU de ONU Femmes ont mis en place une base de données et une analyse unique, ce qu'on appelle le Global Gender Response Tracker. Et là, cet outil essaie d'analyser finalement et nous donner une vue d'ensemble de la réponse par les différents gouvernements. Et on a vu qu'il y a surtout l'analyse sous 3 dimensions, c'est la recrudescence de la violence pendant la pandémie, l'augmentation sans précédent du travail de soins non rémunérés et également l'insécurité économique au niveau de perte d'emploi et surtout les femmes qui sont dans le secteur informel. Et vous allez trouver que les principaux, au niveau de l'Afrique subsaharienne, il y a eu également une augmentation des violences parce que il y a notamment lié au confinement et également le fait que les mesures qui ont été prises, c'était surtout des mesures qui ne permettaient pas, qui ne tenaient pas compte des secteurs d'intervention et de la protection des femmes. Et là, le constat était que sur seulement 16 pays sur 5 qui ont été analysés ont enregistré, non, 16 sur 45 n'ont enregistré aucune mesure avec la prise en compte du genre dans le COVID. Ça, c'est au niveau de l'Afrique subsaharienne. Et là, l'outil qui a été utilisé, c'est le Global Tracker et qui a montré que finalement, il y a 16 pays qui n'ont fait mention à aucune mesure en rapport avec le genre. Et là, je l'avais dit, pourquoi est-ce qu'il y a eu augmentation de violence en période de COVID-19? Vous avez remarqué que surtout, c'est le fait de rester à la maison. Ou finalement, les femmes, ils ont dit que le fait d'aller au travail, parfois, les protège contre les violences domestiques. Un autre élément qui a été un facteur qui est très important, c'est le fait pour les jeunes filles, le fait de ne plus retourner à l'école. Cela a augmenté les risques de mariage précoce. Et le fait de ne pas aller à l'école a augmenté le risque d'autres pratiques néfastes, notamment les mutilations génitales dans certains pays, parce que les petites filles, surtout à l'âge de 10 ans à 12 ans, étaient restées à la maison et on a dit on va en profiter pour tous ces pratiques négatives. Un autre élément comme conséquence importante, c'est la pauvreté. Le niveau de pauvreté, surtout pour les hommes, a pour impact d'augmenter également la violence domestique. Ça a été prouvé, la précarité économique, le fait que l'homme n'est psychologiquement satisfait de sa capacité en tant que pourvoyeur de la famille, ainsi augmente également les risques de violence. Un autre élément a été la surcharge des femmes, pour celles qui sont dans le secteur de la santé et qui devaient en même temps s'occuper de leurs tâches au niveau ménagère. Certains d'entre eux ont été obligés de rester pendant des heures, beaucoup d'heures en dehors de leur famille. Et là, il y a des pays où, parce que tu étais personnel soignant, tu n'as même plus le droit de rencontrer les membres de ta famille pour éviter les contaminations. Donc là, ça a été aussi un impact énorme au niveau psychologique. Un autre élément important, c'est l'impact au niveau du secteur de la santé. D'une manière générale, où on a la COVID, les femmes vont avoir peur de continuer à consulter les services de santé. Et il y a eu des impacts en termes au niveau de la santé de la reproduction et même au niveau de la santé des enfants parce qu'il y a ça et il y a également au niveau sanitaire les structures de santé privilégier d'autres services. Donc là, ça c'est la situation et on peut penser qu'est-ce qu'il faudrait faire pour une meilleure prise en compte du genre, surtout en matière de réduction des risques de catastrophes, mais également d'autres catastrophes sanitaires liées aux pandémies. Là, en termes de recommandations, c'est qu'il faut commencer toujours par des évaluations de risques qui tiennent en compte du genre, pas faire des évaluations d'ordre général ou gender blind, comme on dit. Un autre élément important, c'est en rapport avec les données. Il faut absolument collecter des données qui sont désagrégées par sexe et des analyses également qui sont différentielles. Pas faire une analyse qui est globale, mais faire une analyse qui est différentielle. Une autre recommandation, c'est en rapport avec les évaluations de, comme on dit, PDNA, c'est les évaluations des besoins post-catastrophe. Là, c'est dans les pays, ils sont en train de faire des évaluations de redressement socio-économique post-COVID. Et ça, c'est quelque chose de très important pour assurer de la prise en compte du genre, des besoins spécifiques et faire des analyses par rapport à l'impact différencié aussi qui a été causé par COVID-19. Et cela est vrai pour COVID, mais c'est aussi vrai et important pour d'autres catastrophes qui peuvent survenir. Notre recommandation, c'est en rapport, comme je l'ai dit, les plans et politiques. Donc, dans l'élaboration des plans et politiques de risque de catastrophe, il faut tenir compte de la dimension genre, et tant au niveau local qu'au niveau global et au niveau national. Et également mettre en valeur dans matière de communication, mettre en valeur le gain qu'on a en tenant compte du genre. Le gain qu'on a parce que les femmes, elles sont les plus affectées par les catastrophes, mais également elles vivent dans le milieu, elles connaissent mieux et peuvent proposer même des réponses beaucoup plus adéquates. Un autre élément, c'est au niveau de relèvement. Et si elles sont aussi touchées par le relèvement, elles auront une meilleure contribution en matière de développement, en matière de bien-être des ménages dans les situations post-catastrophe. Dans le contexte actuel de COVID-19, le constat est en rapport avec les axes stratégiques que les pays et les bailleurs de fonds sont en train d'appuyer, qui sont souvent d'ordre macroéconomique ou qui touchent les secteurs les plus affectés comme l'aviation, comme le tourisme, l'hôtellerie, les grandes compagnies. Mais cela est fait au détriment des femmes parce que les secteurs, je dirais, les petits secteurs dans lesquels elles sont plus nombreuses et dans lesquels elles œuvrent le plus, ne sont même pas considérées et ne sont pas suffisamment soutenues. Donc, l'appui direct à toutes ces femmes qui ont été affectées, dont leurs économies, leurs activités ont été complètement bouleversées, et ça va être très important. Un autre élément de recommandation, c'est un rapport avec les données ventilées. Là, j'avais parlé des données ventilées. Et il faudrait que ces données soient disponibles et soient utilisées. Parce que collecter des données, on a vu que c'est une chose, mais pouvoir les utiliser de façon rationnelle, c'est un autre élément important. Une autre recommandation, c'est un rapport avec l'expertise. Faire recours à des experts en matière de genre, que ce soit dans les équipes d'intervention directe, mais également dans les équipes qui rédigent les différentes politiques et les différentes propositions de réponse et les différents plans qui sont élaborés. Donc, savoir qu'il faut de l'expertise et que cette expertise, il faut aussi investir. Souvent, je n'accuse personne, mais souvent, on ne veut même pas payer des équipes. Dans les experts, vous allez trouver que l'expert, on cherche un bénévole, on ne l'intéresse pas du tout, mais il faut investir dans ça. Un autre élément important que je voudrais aussi en termes de recommandations, au niveau de représentation et de participation des femmes. Là, il y a eu des études qui ont été menées sur le niveau de représentation des femmes dans les mécanismes de gestion de la pandémie de COVID-19. Il y a beaucoup de pays. Et Aouline, je pense peut-être qu'elle sera là. On a dû faire un plaidoyer important pour qu'elle soit aussi intégrée dans ces mécanismes. Un autre élément est en rapport avec les messages. Les messages de sensibilisation, on doit considérer les femmes comme de grands acteurs pour mener la sensibilisation au niveau communautaire. Et cela a donné des impacts, surtout dans le contexte de COVID et également dans le contexte de Zika. Et là, impliquer les organisations féminines dans la sensibilisation a permis d'atteindre beaucoup d'impact. Un autre élément de recommandation, c'est surtout un rapport avec les secteurs, comme je l'ai dit, les secteurs dans lesquels les femmes travaillent le plus. Il faut également trouver des réponses qui s'adaptent mieux à ces secteurs d'intervention, parce qu'on l'a vu, il y a des secteurs qui sont complètement négligés. Je voudrais également faire une recommandation en rapport avec pendant la période et dans le relèvement post-pandémie, de protéger les services de santé essentiels pour les femmes, surtout les services de santé de la reproduction et les services de lutte contre les violences basées sur le genre. Comme je l'avais dit au début, on a tendance à les négliger, ou les femmes ont tendance aussi à non plus aller consulter. Il faut des mécanismes d'accompagnement pour s'assurer que même pendant la pandémie, elles continuent à avoir accès à ces services qui ont un impact immense sur leur vie. Et là, pour la dernière recommandation, c'est la question au niveau communautaire, dans la prise en compte du genre, ce n'est pas dans les politiques nationales seulement, mais c'est aussi dans les réponses qu'on a au niveau des communautés, au niveau des villages, au niveau des communes. Et là, on a vu que les messages sur le genre passent très difficilement, mais c'est par là qu'il faut commencer dans la réponse et dans la gestion des risques de catastrophes. Là, j'ai mes 15 minutes qui sont finies, et merci beaucoup pour votre aimable attention.
Thank you very much, Marie-Jose, for your keynote address. Well noted on the key points, looking at the impacts of COVID-19 on vulnerable populations, especially women, and using that gender lens. And thank you as well for the recommendations going forward. Moving on now on the program, as indicated, this gender and disaster risk management in times of COVID-19 event will last 1 hour. We're already 17 minutes into the session. We will now move to the panel session. And this panel is made up of experts from the UN Women ARC, the AUC, and civil society organizations, namely AULIN and the Gender Commission in Zimbabwe. Our first speaker, panelist, would be Dr. Tapiwa Uchizi Nyasulu Rueyemamu, who is the head of division Gender Policy and Development at the African Union Commission. And the question for Tapiwa is, what can be done and is done at the level of policymakers at the African Union in order to protect women in disaster-prone regions, especially in times of COVID-19? You have the floor, Dr. Tapiwa.
Thank you very much, Babatunde, for that introduction. And I bring warm greetings from the African Union chairperson, His Excellency Musa Faki Mahamat. And at this point, allow me just to turn off my video so that we're able to talk properly at this point. So yes, I'm pleased indeed to be here, and this is a very important topic that we're discussing at this point. And with reference to the question that has been posed to me, allow me to highlight the fact that, well, the African Union has tried a lot during this COVID-19 pandemic. And this, of course, is referenced by the fact that, well, we managed at the onset of the pandemic to develop the guideline on gender responsive to COVID-19 that supports our African member states as well as the RECs and other partners to engage and support from that holistic manner. And this, of course, will situate my recommendations as well, as the keynote speaker has highlighted quite a lot of regarding the impact that COVID-19 has had on women and young girls as well. So I will try to point out 8 things briefly that would help that where we need the member states and what the member states are expected to be doing or they are doing as policymakers at that level, where we have 8 enabling principles and success factors that will allow us to achieve this. First is with regards to the fact that, well, there is need for gender mainstreaming and integration. The AU, as I mentioned, recognizes that gender equality and women's empowerment is the cornerstone of its development agenda. And in this regard, GEWE has to be at the heart of its COVID-19 responses. When it comes to COVID-19 emergency preparedness and response plans, as well as long-term recovery plans, they must be grounded in sound gender analysis, considering gendered roles, risks, responsibilities, and social norms, as well as accounting for the unequal, unique capabilities and needs of vulnerable women's groups. Secondly, as the keynote speaker mentioned, is that of the sex disaggregated data. COVID-19, of course, responses must be backed by sex disaggregated data. And this will, of course, guide policymakers and program designers to track, assess, and develop timely gender analysis, which will support more effective and equitable response plans and actions. then as we know that sex segregated data will also influence the allocation of resources and help in establishing a more inclusive response. And that's what we're also expecting and what our member states are currently doing. And thirdly, related to that is the fact that, well, there is the enabling factor of gender budgeting that needs to be taken into consideration. The financial responses to COVID-19 should be gendered responsive and acknowledge the differential needs of women and support gender mainstreaming work related to COVID-19. This also tackles the issue of the disaster-prone areas that needs to be taken into consideration. Fourthly, there has to be a scalable and high impact programs that are synergized and owned at continental, regional, and national levels. The COVID-19 gender responsive guideline that we develop at the African Union, we're looking at it that we'll save a place to a gender spotlight on all AU COVID-19 responses that are designed and implemented at continental. That includes the African Union Commission itself, our organs, the specialized technical agencies, and the like, as well as trickling down to the regional economic blocks and the national level, that is the member states, and ensure that women and girls and men inclusive are equally, are benefiting equally from their responses. Fifth, of the enabling and success factor that needs to be, taken into consideration is that of having strategic partnership and multi-sectoral approaches. As we know that, well, while COVID-19 responses may be government-led, we understand and would urge that the strategic partnerships, collaboration, and synergies must be developed, including strengthening the relationship with the civil society organization and the faith-based, as well as the cultural-based organization, the media, the private sector, international development partners, and the UN agencies and development banks. Sorry, I think I got a message to start my video, but as I mentioned that I'm having internet connectivity, that's why I had to turn my video off. So otherwise it will be very bad for the interpreters. Well, the sixth point that I wanted to, highlight is the fact that, well, there is a need to have an effective and full inclusion of women, and we're looking at women's leadership. And this is one of the objectives of this event that we're having right now. You're looking at COVID-19 responses that they cannot be carried out, in isolation from recognizing women as agents of change, creators and innovators, as well as to fully engage them as active citizens. Without such efforts, we know that the goals of Agenda 2063, as well as Sustainable Development Goals 2030 of achieving gender equality will never be realized at that level. This is something that we have to look at it, even looking at the women in the disaster-prone areas that are coming on board, so that they are able to provide ideas and create certain interventions that are geared towards the needs and the challenges that they are facing at that level. So that's what needs to be taken into consideration. Last but not least, as a way of ending my intervention, is that there is need for enforcing existing commitments to gender equality and women's empowerment. In these troubling times, regard should be had to existing commitments to protect women's rights and promote gender equality and women's empowerment by invoking the enforcement of existing mechanisms such as the Maputo Protocol on Women's Rights, the African Union Constitutive Act, and the Solemn Declaration on Gender Equality in Africa, because these are the times where we need to look into that aspect. Last but not, the last point that I wanted also to highlight is the fact that, well, there is need to document and share what works and find new and innovative ways of measuring success and affirming good practices. I think this is to say that COVID-19 is not a point in time pandemic, and there is likely to be other pandemics in the near future. So it is important to invest in evidence-based research, learn from best practices, and ensure that at all times women and girls are at the center stage of emergency preparedness and responses plans, as well as the long-term recovery plans to build resilience against future shocks. So these are some of the guidelines and the enabling factors, as well as the principles that need to be followed by our policymakers while we are dealing with the pandemic such as COVID-19. And we've seen that quite a number of our member states have actually started implementing by using these adopted guidelines that were made and by our ministers in charge of gender and women's affairs across the African continent. So Tunde, let me leave it here and give an opportunity to my colleagues as well who engage further.
Thank you very much, Dr. Tapio, for that intervention, highlighting the AU sort of overarching response through the guidelines that were developed for COVID-19, and also highlighting and touching on those enabling factors and principles, including having that gender lens, sex aggregated data, gender budgeting, having scalable and high impact interventions and the likes. We'll get back to some of those later in the session. Moving on to our next distinguished panelist, we have Mr. Robert Adjurco, who is lead advisor and heads the Outbreaks and Epidemics program within the ARC group. Mr. Adjurco, your question is, based on the experience from COVID-19 and other recent pandemics, how can we develop suitable social protection or insurance for women on the African continent in such severe global health situations? You have the floor, Mr. Adjurco.
Thank you very much, moderator Babatunde, and then thank you to the organizers. It's a great opportunity to be here to share some thoughts on the gender and disaster risk reduction and management in times of health emergencies. I heard the previous speakers, Madam Marie-José and Dr. Tapiwa, and I think we are all speaking around the same issue, which is the concern around the gendered impacts of public health emergencies, or emergencies in general, and the complexity that is faced.
Sorry, Robert, we're having some audio challenges.
Can you hear me?
Hearing you.
Can you hear me now?
It's a bit faint still.
Can you hear me now?
Yes, better.
Right. Okay, so the salutations over. Thank you, and thank you also to the earlier speakers. And I was talking about the fact that we are all talking around the same topics, it seems, which is the importance of understanding and recognizing the gendered implications of disasters. And I'm looking at the public health part now. So the complexity and then the vulnerability that is faced by women. Public health emergencies such as COVID-19 and Ebola and others tend to exacerbate the already imbalanced situations on the ground. So you have the social, political problems. We've had the mention of gender-based violence. You can include child marriages. We've spoken about the economic systems, which is lockdowns and curfews and how they affect the income of women, especially in the informal sector. And we've also looked at issues around unemployment and then the rise in poverty. But let me just put a few facts on the ground so that we see the enormity of the problem that we're dealing with, and then we see what recommendations can go beyond that. So here I'm looking at data from WHO, from UNDP, UNICEF, UN Women, and then the Project Hope. So during COVID, estimates show that there's about 40 to 50% drop in the utilization of essential reproductive, maternal, and neonatal services, including immunization. We are looking between 8.3% to 38.6% more pregnant women who will die each month due to inaccess to health services. So something as simple as curfews at night or curfews at any time, stopping women from accessing health services, put their lives at risk. For example, in Kenya, hospital delivery rate dropped by 70% in April of 2020. And in Uganda, maternal mortality went up by 82% between January and March 2020. So here, quickly, you see that beyond the COVID-specific issues or the deaths and co, there are secondary effects that needs to be looked at. Now you look at children. You had about 1.3 million children who missed their BCG, which is the TB, anti-TB vaccinations. 1.32 similar amounts missed their measles vaccinations across the continent. But this is not only for the COVID. If you go back to the 2014 to 16 Ebola crisis in West Africa, you have the same playing out. In Liberia, there was about a 30% drop in measles vaccinations, which led to a 5-fold increase in numbers. In the Sierra Leone, similar. So every time there's a pandemic, the point I'm making is there are additional health implications that we need to look at. And any action that governments take must be transformative and must provide the protection that women need. And there are a few areas that I want to look at. Whatever action that comes on, of course, has to be preventative of the ensuring that there are plans in place. We must protect lives and livelihoods, promote women, and also transformative as in addressing the structural inequalities that make women and children more vulnerable. There are 3 or maximum 4 areas of recommendation that I would like us to look at. The first is to look at issues around income. So on income and expenditure, there are ways that we can help women, innovative, gender responsive fiscal policies, revenue measures that can target women, especially women-headed households. We can also look at direct cash transfers for countries that have those social safety net work that can happen. So in the area of income and expenditure and ability to access services, food and co, I think that is one area that we can look at. Personal safety is also another area. We had the numbers around violence against women during COVID and during lockdown. So this is also personal protection for women, ensuring that the police and security agencies are understanding and helping in this area. And also educating men, mainly here directly on the dangers that this pose. Child marriages I spoke about. And especially also women with disabilities could be one area that we can look at. The third will be specifically on health. When a country is better prepared, it is able to mitigate the shocks of these pandemics. So early preparedness, putting in place all the risk modeling and interventions, and also teams in place that are going to respond are areas that countries can look into. And this is where something like the Outbreaks and Epidemics Program can help countries with other partners to support. So better preparedness, which will lead you to the ability to respond to the outbreak or the pandemic when it happens. It will help you to deal with your primary problem of the COVID or Ebola, as well as free hospitals from overload and overwork of doctors to be able to respond to the routine services and the immunizations and other areas. So Tunde, in short, these are some of the areas of concern when it comes to public health emergency. You deal with the primary pandemic, and then you have the secondary effects all of which needs to be addressed. I will stop here and give my colleagues also an opportunity to contribute. Thank you very much.
Thank you. Thank you very much, Mr. Adjurco, for that input and intervention with regards to the recommendations to member states in terms of actions they can take at the national level in terms of addressing the impact of COVID-19 on the vulnerable population, especially women, and for also giving those insights as well on the ACT program and how it can support and other issues such as issues of income and personal safety, as well as the early preparedness side of things. So thank you very much. We will be going next to our third speaker and panelist, who is Ms. Lorraine Ombodza. Ms. Lorraine Ombodza is the Manager, Research and Programming of the Gender Commission for Zimbabwe. And the question posed to Lorraine is, from your experience in Zimbabwe, if COVID-19 is classified as a disaster and that women and other vulnerable groups are the most affected, which strategies can African governments put in place to reduce vulnerability and strengthen resilience of women, the elderly, children, and people living with disabilities? Also, what data is available in terms of the impact of COVID-19 on women and other vulnerable groups globally and specifically on the African continent? And what does this data tell us about women's resilience and empowerment? You have the floor, Ms. Lorraine.
Well, thank you so much, moderator, for this opportunity. And also thank you to the organizers of this platform. Also, because of my internet connection, allow me to maybe stop my video sharing so that I don't have any internet challenges. So for Zimbabwe, yes, COVID-19 was declared a pandemic, a disaster in March, that is March 2020. And also the government also adopted a host of measures to contain the spread, a total lockdown, which was actually then imposed. Then also you'd note that the COVID-19 pandemic and its related restrictions, they had far-reaching socio-economic impacts on the well-being of the population, especially women and other vulnerable groups. And also from the perspective of Zimbabwe, you would note that COVID-19 further escalated the impact of drought and cyclone Idai, which also put to actually reversing the gains, the gender equality gains. So in the prevalence of COVID-19, you were affected by the virus. As of March 2021, of men comprised 54% of those who were affected by the virus, and women comprised 46% of those affected by the virus. And in terms of those who succumbed also to the virus, you would also note that more men than women are succumbed to the virus. I think this mainly relates to issues around health-seeking behaviors. You would note that for men, they do not have good health-seeking behaviors as compared to women. you'd know that men will then seek for health services at a later stage as compared to women. And in terms of the age that was most affected, in terms of those who succumbed to COVID-19, the age group between 61 and 70 years was the most affected in terms of those who succumbed to the virus. But also in terms of the socio-economic impact of the pandemic, you'd note that women bear the brunt of the socio-economic impact of COVID-19, and you'd also note that the pandemic amplified already existing inequalities in our countries, in our societies. One of the impact of COVID-19 was increased burden of care and domestic work for women and adolescent girls. This was mainly due to the lockdown restrictions, where people were expected to stay at home, and this in turn actually reinforced the traditional gender roles, the care roles of women. And also you'd also note that due to those the lockdown restrictions, the informal sector was heavily impacted. And we all know that women constitute the majority of those who are employed in the informal sector. And this meant that more women lost their sources of livelihoods as the informal sector was closed. And I think for African governments, it is also important for African governments to start thinking around availing sustainable livelihoods for the population, especially women and other vulnerable groups. You'd also note that in the case of Zimbabwe, we also experienced an increase in cases of gender-based COVID-19 pandemic, but also we were faced with a shadow pandemic of an increase in cases of gender-based violence, child marriages, and teenage pregnancies. And also at the onset, GBV services and SRHR services were not treated as essential services, and this really impacted on access to comprehensive GBV services and also SRHR services. In terms of strategies for African governments to strengthen resilience, I have a number of proposals. Firstly, it is actually important for African governments to strengthen social protection systems, in particular availing social safety nets in order to cushion vulnerable population from the adverse impact of disasters. In the case of Zimbabwe, there was an introduction of a stimulus package, which was availed to small and medium enterprises, which was basically aimed at resuscitating SMEs which were affected by the lockdown. And you'd note that of the resources availed, 42% of the total stimulus package actually benefited women-owned enterprises. Another key recommendation that I want to also reinforce, I think it was also highlighted by previous speakers. This is relating to the need to seriously mainstream gender into the national humanitarian response architecture, so that issues of gender are not really like an afterthought, but this should be an integral part of the whole humanitarian cycle. And this also includes ensuring that gender considerations are taken into account in terms of positions of decision making in humanitarian response architecture. I think these were my my recommendations. Thank you so much.
Thank you very much, Ms. Lorraine Ombodza, for those keen insights from the perspective of Zimbabwe, both from government response to the COVID-19. We were to have one more panelist, but due to time as well as unavailability, we will move to the next section of our session. If you allow me to go into our Q&A session to receive questions from the audience. I've checked the chat box and we have no questions at the moment. So what we can do at this stage is probably go back to our panelists to give one key recommendation in terms of the way forward for this session. I would like to invite our first panelist, Dr. Tapiwa, for one key takeaway from this session.
Thank you very much, Tunde, for that. I think, as you know, just to mention, and it has been demonstrated here, and getting the experiences from Zimbabwe, and also from Robert, giving us the data that it is to be recognized that indeed COVID-19 has that multidimensional impact on women, who are, if you look at it, the majority of the population in most African countries. And women are, we've seen that, well, they've been affected by the impact of this pandemic more as well, and ignoring their concerns and needs in the COVID-19 responses, might threaten the consolidation of the gains made in the advancement of gender equality and women's empowerment and women's rights in the continent. And that, of course, including women in the disaster-prone, places. Therefore, I think it is very, of critical importance that responses towards the prevention, containment, management, and eradication of COVID-19 should take into account gender equality and women's empowerment, so that women and girls are not left behind. Together, we shall be able to achieve Agenda 2063, as well as Sustainable Development, Goals 2030. That's something that we have to look into that. Over to you, Tunde.
Thank you very much, Dr. Tapiwa, for that final key recommendation, which is very well noted and will be contained in our post-event reporting. I would like to also now give the floor to Mr. Adjurco Robert to give his final recommendations for the session and a takeaway.
Okay.
A key takeaway. You have 1 or 2 minutes, Robert.
Thank you very much, Tunde. So for any problem, when you want to deal with it, the fundamentals needs to be addressed. And I think one key that I'll put down here is girl-child education. I think it is important that we make inroads into this and improve across the continent. The more women, the more girls that go to school, it changes not only a family. They said if you educate a girl, you educate a whole family. So I think that is one area. But specific to health, and on the point that I made, I think our countries, our member states can do better in preparing for these health emergencies. And with all the problems that we have we've just addressed or outlined, looking at immunization, antenatal care, maternal and child health care, we can ensure that there is services go to communities if hospitals are closed, and bring the services closer to mothers and to girls. So these are some of the areas that I feel we can target for rapid action. Thank you very much, Tunde.
Thank you very much, Mr. Robert Adjurco, our head of outbreaks and epidemics, for that key recommendation for us to take away. girl child education and on the health side as well. Well noted, and this will be contained, as I mentioned, in the post-event reporting. I would like to give the floor to our third panelist, Ms. Lorraine Ombodza from the Gender Commission of Zimbabwe. You have the floor for 1 to 2 minutes to give your final key recommendation or message as takeaway for this session. You have the floor, Ms. Lorraine.
Thank you so much, moderator. So I think is one of my key key messages that I want to reinforce. It's around the need for
Ms.
African
Lorraine, we're not hearing you.
governments really the vulnerability levels. So my recommendation within African states. Thank you.
Thank you. Thank you so much, Ms. Lorraine. We sort of had some internet connection issues from your end. We will be grateful to have this in writing post the event, or you can share that on the chat box. But thank you very much for that key recommendation, and we will follow up definitely on getting that from you for inclusion in the post-event reporting. Finally, I would like to give our keynote address speaker to give her final remarks, Mrs. Marie-Jose Kandanga of UN Women. You have the floor, Ms. Marie-Jose.
Je vais, pour conclure, encore une fois revenir sur le fait que les femmes comptent pour la réponse au COVID-19. Les femmes comptent dans le relèvement post-COVID-19. Et un autre élément important, même si on a tendance à les rendre invisibles ou à ne pas reconnaître leur apport, on doit reconnaître que la prise en compte du genre, c'est un investissement qui est gagnant. On gagne en investissant. Je dirais que c'est le retour qui est sur investissement qui est multiplicateur. Donc, là, en investissant dans la prise en compte du genre, dans la réponse, que ce soit dans la prévention de COVID-19, que ce soit dans le post-COVID, on aura des réponses rapides, on aura des réponses efficaces et on aura même de l'efficience, on pourra avoir même des réponses à des coûts beaucoup moins chers. Ça, c'est au niveau planétaire. Un autre élément qu'on doit reconnaître, c'est éviter des analyses globales. Parler de la COVID avec la population d'une manière générale et chaque fois faire attention pour une analyse différenciée. Différencier comment est-ce que les femmes sont affectées différemment, différencier quels sont les besoins spécifiques et cela va pouvoir aboutir à des réponses, à des plans globaux, des plans nationaux qui tiennent en compte des vulnérabilités des uns et des autres et qui tiennent en compte du potentiel des uns et des autres et dans le cadre qui nous concerne, du potentiel des femmes pour répondre efficacement au COVID-19. Merci beaucoup.
Thank you very much, Ms. Marie-Jose from UN Women for that key recommendations. As indicated, this will be included in the post-reporting report of this session. Dear participants, ladies and gentlemen, that brings us to the close of our session today on the event titled Gender and Disaster Risk Management and Reduction in Times of COVID-19. We thank you very much for all the speakers and panelists for your insightful contributions and interventions, as well as those who were listening. We thank as well the interpreters and all those who have helped with the technical background to make this session a success. We thank you all very much. And as a closing, we will be playing the ARC and AU Gender and Disaster Risk Management platform launch video in English and French. So I'll be playing that from my computer shortly. Thank you all very much once more for your contributions. Much appreciated.